whoever is the first time, my name is Joanna and I am a medical interpreter. And I'm creating this video dedicated to Weled Al. Hi, Weled. Thank you for your comment and thank you for your question. You know I like to answer your questions and I like to give you a little bit input on your medical interpreting careers and anything related to languages. So Walid asked me a question, and the question is, what is the difference between bilingual person and trained medical interpreter? Okay, so I would use the word certified medical interpreter because trained doesn't mean much in our field. So bilingual person is just a person who speak more than one language, not professionally, which means that, let's say, for example, in their home, they speak one language and they're living in America and they speak English, study English at school, and so on. Just a person who is fluent or semi-fluent or have some basic knowledge of a second language is bilingual person, or speaking language in a level to travel. Like, for example, I speak some Spanish, si yo hablo un poquito español, pero el mio español es más facilare, no? So my Spanish is very basic. I can use to travel. I am not speaking grammatically correct. Okay. Medical words. I'm not trained as a medical interpreter for Spanish language, so I am not as fluent, and I'm not working as a medical interpreter with Spanish. Probably I did some small works in OBGYN because Spanish and Italians are very close. And as you know, I do speak Italian, so I can understand very well Spanish. So I did a little of medical interpreting in Spanish, but I'm not certified in. I always do it with a lot of hesitation, only when it's necessary, when it was necessary, and they couldn't find anyone else, and the doctor really needed to understand what was going on. But I am not trained in Spanish, and I'm not like ready to do it. I'm not doing it with closed eyes. I'm not like fluent. I'm not easygoing yet. So fluent in a language or being bilingual mean more to speak like a common languages, like having a normal conversation, talking about yourself, ordering food, ask for directions, ask for things, purchase things, and so on. And being medically trained, it means that you have studied nine body system. I have a book somewhere here. It's right there though. So you have studied nine body system, most common disease related to this system, most common procedures related to this system, and medical terminologies in general, including body parts, symptoms, I don't know, a different unusual instruments that we use, for example, stethoscope or any kind of scopic procedure, most common surgeries as well, or most common procedures. Also, medical interpreters, out of being trained for nine body systems, are trained for dental. Dental is a special part aside that you study the instructions, a little bit about oral surgery and some terminology related to oral surgery. Not only we study the nine system, but we do also get trained about different disease. And I'm not talking about like disease that are most common, what these diseases are, what they mean, the most common symptoms, the most common treatment, just for general culture. These kind of words we study in the both languages. Let's say I study in Bulgarian and Russian. I study those in five languages, so I'm very precise in medical. I can tell you guys with symptoms, with synonyms, I'm very good. I'm very good to find a target word, and if I am not, if there is no time for it, if it's 911 for example, call, I am very calm and I can explain it like very fast. For example, the word gallbladder, uh, for some reason in Russian language it's желудок, желудко, and желудок is the stomach, and the gallbladder is желудок, which is the part on the top of the liver that sometimes get removed. And I would often forget the term, so I would explain where is it, and the doctors know right away. So the difference is that medical trained interpreter or certified medical interpreters, and I will tell you, it took me a few years to learn them, like not to worry about it. It took me about 2 years, even though the training was short, like to be actually fluent in this medical world. Let's talk about, there is some terms related to procedures like surgeries and sewing, especially if the patient has something broken and they're conscious and the doctor explains them that we're gonna make a small fissure and we're gonna do this and then we're gonna sew you and then we're gonna stitch you and then we're gonna put some of this. So this is like a very specific language, as well as legal. So I'm doing at the moment legal training, and my head is like all over burning of it. But so bilingual is a person who can be even very fluent in a second language, but this doesn't mean that he can interpret. And from being bilingual, as I come to America working as a business interpreter, for me to interpret in medical field, I was so worried, because in medical field there is an extra responsibility. If you make a mistake, somebody can die. That's what they say. Medical interpreting is so important, because if you make a mistake in a medicine dose or in anything, in any symptoms, even in the smallest thing, sometimes they call 911, and it's fundamental that you know these terms like really well. My precision is 98% in medical, which means that I know, guys, sometimes when I do these videos, I am not like forcing myself. I'm not studying them before I get and tell you the target language words, but like being precise 98% in medical is like close to really extremely genius. So if you are bilingual, guys, and if you want to be an interpreter, just study 9 body system in the both languages. And I promise you, going to do 40 hours of training and then taking the test is not gonna be enough. I personally studied the body system for 1 year, all of them, with the so when I went and I took the 40 hours of a medical interpreter training, so-called BTG, this certification right here, I took the test. It was okay. I was ready to take it. I did study a little bit while I was going to class, to school, but you cannot study 9 body systems in 1 week in 40 hours, or in it need times for your brain to settle all this information. So this is the difference. Thank you, Walid, for your question. And if you're interested to do some of those training, I will advise you MIT and CCHI. They're highly priced. This is a CCHI behind me, and you can get pretty good payment for this. Thank you for being here and have a good day. Bye bye.